50 Plus in Montgomery County, a monthly program that is a voice for many, produced by the Commission on Aging, of which I am a community member. While the show is insightful for people of all ages, each episode takes a fresh look at important issues by spotlighting older adults in the community, representatives of services and programs, and activities of interest to older adults. My name is Katie, and as many of you know, November is recognized as Alzheimer's Awareness Month, as well as National Family Caregivers Month. Today, our discussion will focus on older adults of all ages who are among the ranks of family caregivers, as well as older adults living with some form of dementia or Alzheimer's disease, and how we can keep them safe. Joining me to discuss caregiving is Lily Fisher. Lily is a facilitator of Montgomery County's Caregiver Support Program, and she works in the county's Department of Health and Human Services Area Agency on Aging. In addition, Lily is also the host of the hit YouTube series, Engage at Home. Hi, Lily.
Hi, Katie. Great to be here.
Great to talk to you. Lily, the challenges of being a family caregiver have generally been viewed as private and personal. How can we improve the lives of caregivers who invest so much of their time caring for a parent or spouse or other loved one, often at personal, significant cost, with little guidance and a lot of exhaustion?
Great question, Katie. Yeah, often caregivers are juggling multiple responsibilities. They've got their own families, they've got work, and the need to self-care. And what we find is that caregivers really benefit by having those flexibilities in their employment arrangements, really having it that their team, their siblings, their partners, their children are making the effort to understand and appreciate their caregiver efforts. And I'll be frank, making sure that the community and medical supports are responsive, and these help to ensure that the caregiver is able to maintain their own health and wellness.
Lily, there are so many resources available to help caregivers. Can you tell us what type of information, services, and support is available?
Here in Montgomery County, the support is delivered to caregivers by a whole range of mechanisms. Some of them could come through the county's caregiver support services, but we also see nonprofits, and they are providing care, and also home care businesses. The county provides really outstanding support through its respite care program, and this provides short-term care at no cost to the caregiver, and it's delivered in the home or in a community setting. Respite allows the caregiver to feel comfortable to leave the home, for example, to run some errands or look after that important self-care. Oftentimes we see caregivers take advantage of their faith-based communities, and these provide no cost and affordable services. Additionally, one of the things in Montgomery County that we're proud of is that the county pays the Alzheimer's Association to provide free caregiver support groups, education programs, and caregivers have access to their 24/7 helpline. We're seeing a lot more of elder care managers coming part of the picture, and these help to coordinate home health agencies and also those allied providers who are providing fee-for-service supports. As you can see in Montgomery County, there's a range of supports for caregivers, and they come from many angles, and that's something that we want caregivers to remember.
Lily, how can we learn more about caregiving, and where should caregivers begin to prepare for care?
Okay, so to begin to care, one of the best things to do is bring the family together, whether it's your family of choice or your family that it's your birth family. It's a coordinated approach. And here in the county, what we suggest people do is look at the resources we have. You can go to the county's senior webpage, and that has links to our caregiver blog. Our website has a range of resources. And through the blog, you can also learn about all of the services that are provided through those partners that I talked about earlier. You can also learn about free or no cost activities that are just out there in the community waiting for you to take advantage of them. And we also have a lot of articles that are put together to provide caregivers with some real background around the country. It's not just what's happening in Montgomery County. Resources are available to everyone, particularly in this digital age.
Lily, are there ways to engage family caregivers as partners in healthcare and long-term care services?
Yes. And one of the things that we really try to encourage people to do is have that coordinated approach. It's valuable for caregivers to be well organised and willing to be consumer advocates for themselves and their loved ones. Keeping track of medical records, prescriptions, and the names and contact details of the regular physicians is important. And particularly when people are providing care for a loved one as really the lead in their team. Like they may be the spouse or the sibling, but there's other family members or friends helping. One of the things we suggest is digitize, get all of this information and have it so it's organized. We often suggest using Google Drive platform, and that's really helpful to keep all the information in the cloud. It's also very flexible to be able to access information from an electronic device like an iPad or an iPhone, and really good for sharing with each other, but also with physicians. More and more, as I mentioned earlier, elder care managers are also helping caregivers with that valuable resource of helping with that coordination. It doesn't have to be long-term, it could be just for a short term, but to keep well organized is the name of the game.
Now, Lily, we only have a little bit of time left, but you also have a hit YouTube show called Engage at Home that I encourage all of our listeners to tune into if you're not already doing so. Now, briefly tell us what types of programming airs on Engage at Home.
Engage at Home features trusted government information. We've got updates from county, state, and federal, and it also has stories that focus on health and wellness, exercise at home, the arts, cooking, virtual chorus, and much more. To date, we've reached over 140,000 viewers.
Lily, I want to ask you so many more questions, but I know that this is not a one-time opportunity to learn from you. Now, how can our viewers stay in contact with you and again, engage at home?
Excellent. So the first thing, if a caregiver does have pressing needs, please contact the county's Aging and Disability Resource Unit, 240-777-3000. We have team members on the phone ready to provide support. If people want to learn more and look at Engage at Home, they can access that through the county's website. And through there, you can link to Engage at Home, the blog, and all of the other resources I mentioned.
Thank you for taking the time today.
Thank you.
Up next, we will talk with Sheila Griffith, who is the program manager for the Alzheimer's Association National Capital Area Chapter.
The Beacon newspaper's virtual 50 Plus Expo will offer an extravaganza of information for the area's older adults and their families. The event will take place on an easy-to-use website offering free access to speakers on a variety of health and financial topics, including our keynoter Diane Rehm, classes including exercise, cooking, and more, entertainers ranging from comedians and rock and roll singers to Broadway and classical music, plus 50 government agencies, nonprofits, and businesses offering services and products designed for older adults. All of this will be available free of charge 24/7 for a full 3 months from Monday, November 1st through January 31st. And valuable door prizes will be awarded throughout the period. More than 9,000 people visited our virtual expo last year on their computer, laptop, tablet, or smartphone. Don't miss out this year. Make a note now to visit beacon50expo.com. Again, that's beacon, BEACON, 50expo.com. Starting November 1st. Sponsored by AARP Maryland, DC, and Virginia.
Welcome back to 50 Plus in Montgomery County. Joining me is Sheila Griffith. Sheila is the program manager for the Alzheimer's Association National Capital Area Chapter. Hi, Sheila.
Hi, Katie. Thanks for having me.
I'm glad you're on today. Sheila, you do the important work to heighten awareness, help individuals living with dementia or Alzheimer's disease, as well as show support for their family and loved ones. Can you talk a little bit about the Alzheimer's Association, which we know focuses on research, risk reduction, and early detection, and quality care and support?
Well, thanks, Katie. That's exactly it. That is our mission in a nutshell. Research, what we're known for, risk reduction with the disease, trying to provide quality support and care for everyone who has a disease, and just basically trying to find a cure. That's our vision for the disease, is a world without Alzheimer's and other dementia. So we're hoping that we are helping to create that world.
Can you briefly delineate the difference between Alzheimer's disease and dementia and the warning signs?
That's great. Yes, I would love to. That's our number one question that we're asked when we do any of our community outreach. My colleagues and I, we always agree that there is some confusion about, what is Alzheimer's disease? What is dementia? And are they the same thing? And so let me start with dementia first. Dementia is really a symptom of something. So we like to describe dementia as a giant umbrella. And it's an umbrella of symptoms, so called dementia. So there are things like short-term memory loss, problems with thinking, reasoning, in general, something not right that is interfering with our daily living. So that we're not able to maybe do the things we normally would because we're forgetting them, we're getting lost, either driving or walking. So dementia is a symptom that something is not right. And it's occurring over and over. It's not just one day we lost our keys. Do I have dementia? No, that's probably just a normal part of whatever you're going through, maybe multitasking or just forgot something. But with dementia, it is really going to affect your daily living. And people say all the time, well, how do I know the difference? And I always say with dementia, it's something you're realizing that something is wrong. You can't retrace those steps the way you normally would. So if you've lost your keys, you'd think to yourself, and you'd start looking for the keys, and you'd think to yourself, where's the last time I saw them? Dementia is a symptom that something is wrong. Now, for most people, under that umbrella of dementia, it's leading to a disease. And there's many diseases that are under the dementia umbrella. Alzheimer's disease is the most common disease under that Alzheimer's umbrella, under that dementia umbrella. So the best thing you can do if you have problems with memory or problems you think with reasoning or thinking and suspect that it may be dementia is to get to the doctor to find out what it is. Now, with Alzheimer's disease, there's a lot of things they can try to help you with to try to see if they can lessen the symptoms. But Alzheimer's disease is a progressive brain disease that right now, as I said earlier, we have no cure for, and that we hope someday to have a cure for. But there are other diseases under that umbrella. So if you have dementia and you've been diagnosed with dementia, and it's not leading to Alzheimer's disease, it could lead to another disease like vascular dementia, Lewy body dementia, also even Parkinson's has dementia as a symptom. And so sometimes getting the diagnosis is very valuable, getting it early, because maybe there's some things, some of the other diseases that there's interventions that a doctor can recommend.
Now, Sheila, there's also value in education, and it's vital to facilitating a meaningful life for individuals with Alzheimer's disease and their caregivers. What are the education programs and services you run locally?
Well, we have many services locally that we run, and I just want to say that the way people usually get in contact with us is, and this is what it's great today to be talking about this, is to raise the awareness and the understanding. So getting this diagnosis of dementia, first of all, or Alzheimer's disease, second of all, is devastating. And it kind of stops you in your tracks. You know, what's the next step? What should I be doing? Sometimes you have a great doctor who can really help you and figure out, you know, what your next steps are, give you some ideas. But that's what we do at the Alzheimer's Association, is we help you with those next steps. Now, this is what we offer, is you hit the nail on the head, education programs, learning, and all of our programs here locally are virtual right now. We obviously did everything in person, just like everybody else prior to the pandemic, and we've pivoted everything to be now virtual. So our education programs are a great way to learn about the disease. You know, what should I expect if I'm diagnosed? What can I expect will happen next? How will I be affected by this? What's long-term? What's short-term? You know, what should I tell my loved ones? What should my caregivers know? So it's a great way to learn about it. And you can learn through a live webinar. You can look on our website and find out when those are occurring, or you could do an e-learning education program at your own pace. And so we really try to, you know, offer everything we can to educate. Secondly, we have great caregiver support groups that meet here locally. We used to meet in person, as I said, and now everything's virtual. And so we have these great group meetings that are caregivers coming together, talking about their journey with Alzheimer's disease with their loved one, and sharing tips. You know, sometimes that's the best part of the meeting, is just hearing how I have, you know, overcome maybe a particular challenge with my loved one with Alzheimer's disease. And that's helpful to somebody else who may not even be at that point yet, but then they know what to expect and they know maybe an intervention that could work. So we really, you know, love to have people in our caregiver support groups and helping each other. And last, we have our helpline. We have a great helpline that is an 800 number, 800-272-3900. And this is answered by social workers, and they are able to take your questions or your concerns or requests for resources, whatever it is, and really talk to you about that. So it could be something like a question about, all of a sudden, my loved one who has Alzheimer's disease is not sleeping at night, or they are not bathing. They don't want to bathe anymore. What should I do? What can I do? How can I address this? So these are great people on the line who can give you great advice. Sometimes it takes more of a local person to really put you in touch with, you know, our adult daycare centers open in Montgomery County, or our senior centers open in Montgomery County. So that's something they would then give to me, and then I would be in contact with you with a question like that. So we're all about education and trying to increase our outreach to our community here in Montgomery County anytime and everywhere and all the time we can.
Thank you so much for that, Sheila. You know, you mentioned that Alzheimer's disease and dementia are really devastating diseases. And you also provided some great tips for managing stress related to diagnosis, particularly through your education programs and connecting to others. So we really appreciate all the support that you provide for someone who is living with, you know, one of the diseases, and or caring for someone with Alzheimer's or other dementias. We appreciate you. How can we stay in contact with you?
Well, I think you have all of my contact information, but I'll say my name again is Sheila Griffith, and my email is sagriffith@alz.org, and our website, which is simple, alz.org. So please look us up, and if you put your zip code in, you can see your local resources here in our area.
Thank you again, Sheila.
Thank you.
Up next, we'll talk with Officer Lori Reyes, who is the unit coordinator for the Montgomery County Police Autism, Intellectual and Developmental Disabilities, IDD, Alzheimer's, and Dementia Outreach Unit.
Have you taken a taxi lately? Montgomery County wants to hear from residents with disabilities and residents over age 65 about their experiences taking taxis to get around. To complete a short survey over the phone, please call 240-777-1350. Leave your name and phone number and we will return your call. Again, that's 240-777-1350. Leave your name and number and we'll call back.
Welcome back to 50 Plus in Montgomery County. here to talk about the Montgomery County Police Autism, Intellectual, and Developmental Disabilities, IDD, Alzheimer's, and Dementia Outreach Unit is Officer Lori Reyes. Officer Reyes is the unit coordinator for the Special Operations Division. Hi, Officer Reyes.
Hi, hello, thanks for having me.
Oh, I'm glad you're here to talk to us. Now, Officer Reyes, the IDD, Alzheimer's and Dementia Outreach Unit has worked to create what is now a culture of awareness in Montgomery County and beyond. Tell us about it.
So I'm very fortunate that in 2004, I was presented with a challenge or the task to develop a program because we were seeing an increase in calls for service for those in the community that you mentioned, autism, IDD, Alzheimer's, and dementia, that had wandered or eloped. So what we found was, yes, of course, we are responding to those calls, but we needed to do more. So our program began this broad approach with education of our officers, individuals, caregivers, outreach, empowerment, follow-up, and response, so that we can provide, like we said, this layered, broad approach, not only just reactive, but proactive.
I like that, a layered, broad approach. That is very interesting. Now, Officer Reyes, you've been in public safety for 17 years. That's a while. So you obviously know a lot about the topics of caregiving, Alzheimer's disease, and dementia that our previous guests, Lily and Sheila, talked about. What are some of your recent concerns about both of these matters?
So to correct you, not to make me any older, but I've run the program for 17 years, but I've been a police officer for 24 years.
Wow.
Right? So I'm very fortunate that I have a lot of years of experience within the, let's focus on the Alzheimer's and dementia side. So what we were finding was that we were handling more calls of what we now refer to as missing at risk, meaning somebody had wandered or eloped, is a common term, from home or from a location. So that's probably been one of the largest challenges for us in law enforcement. We handle, this is a kind of shocking statistic sometimes, we handle 3 to 8 usually fines a week, 3 to 8 fines a week of individuals that either we in law enforcement or a community member comes across that's lost, that can't find their way back home. So that can bring a lot of different challenges and dynamics in interaction with someone who has dementia or Alzheimer's. So that's probably been one of our biggest challenges that we've addressed.
So what can we do to prevent wandering and prepare for such an event?
You know, that's a good question, and thanks for asking. So a couple of things to keep in mind. When I talk to caregivers, the first thing when we do a follow-up after an event, most people are embarrassed that the event happened. So I say to them, listen, it happens to the very best of caregivers, and you can prevent it. You can try to prevent it, but it doesn't mean that it still won't happen. So the most important message to convey is we're going to tell you some ways to prevent it. But if it does happen, we're here for you. We are here for you. We are children ourselves. We have parents that we're caring for. We are here for you. So now back to your question on prevention. First and foremost, hear me loud and clear. You have to call 911 immediately if your loved one is missing. It's okay to call 911. I know some people think, well, I can't call 911 because it's not an emergency. Well, of course it's an emergency, and we want to get your loved one back home. So the first step is calling 911. The second step are things to consider, just some very quick kind of points. Maybe an identification bracelet for your loved one that just has a name and a phone number, maybe some door chimes on the doors, alerting your neighbors. All of those things are so important, but calling 911 right away, not thinking we're going to be upset or or, that we're going to judge you, just call 911. That is the most important thing to do, and know that we're here for you.
Thank you for that, Officer Reyes. It's good to know that you're here for, Montgomery County residents. Now, how can family members or caregivers engage with you, and how can other organizations collaborate with you?
Oh, another good question. So I'm pretty fortunate in that I've kind of made this program my life's work, right? So for me, when I engage with a family, I say, email me, call me, but that initial meeting, right? That initial contact, I might provide them with a referral to other organizations, Alzheimer's Foundation, our own Montgomery County Department of Aging and Disability. I would refer them to other organizations that we all kind of work together to make sure that all possible resources for all in the community are provided. And that's kind of how we collaborate. And the other great thing about our program is that we, the police, partner with so many organizations in an effort, again, to spread the word that you're not alone. You're not alone on this journey. And we're all here for you, whether it be our patrol officers that have boots on the ground that are searching for you or searching for your loved one, from the employee through Montgomery County Department of Aging and Disability. We're all here for you. It takes us all. We all need a support from time to time.
That's right. We definitely do. Would you like to share your contact information, Officer Reyes?
Sure. So my email is Laurie, LAURIE .Reyes, REYES here we go, Montgomery County MD, not done yet, .gov. So Laurie.Reyes at Montgomery County MD.gov. That's my email. That's probably the best way to reach me. The other way to reach me is my cell phone. It's 240-855-1605. And I say sometimes it's good if you can to text me, maybe say, Lori, can you give me a call? Officer Reyes, can you call me? But email is usually the best, but we'll find a way. If you're reaching out to me, I'm going to get back to you one way or another.
Well, Officer Reyes, thanks so much for providing, those means of contacting you. We can call your cell phone, we can text you, we can email you. Is there anything else that you would briefly like to share with us in the last 30 seconds?
So real quick, I just want to say how proud I am of our officers in Montgomery County, because a key component of our program is the response piece. And I can't tell you how many times officers have searched and found individuals, and how proud they are to be able to bring a person home. They're proud. They're not upset at a caregiver. They're proud and honored to be able to find individuals and bring them home as part of their police responsibilities. So thank you for that. Just wanted to share that.
Officer Reyes, thank you for all you do with law enforcement to quickly identify and return to safety a person with Alzheimer's disease or related dementia who has wandered locally or far from home. We really appreciate your almost a quarter of a century service to us, and we're equally grateful for the outreach programs that you've developed for our county and being willing to let residents stay in touch with you. Thank you again for taking the time.
Thank you.
Well, that concludes our program for today on family caregivers, older adults living with some form of dementia or Alzheimer's disease, and how we can keep them safe. As you can see, the voices of those 50 plus matter every day and in every way. To learn more about services for older adults in Montgomery County, please visit the Montgomery County Seniors website by visiting montgomerycountymd.gov/senior, or to call the Senior Resource Line at 240-777-3000. And as always, thank you for watching 50 Plus in Montgomery County.